So, Assalamu alaikum, everybody. Welcome to a panel today, collaboration between American Muslim health professionals, AMP, and Muslim pre-meds. So we're so excited to have everybody here. We've been planning this for, I'd say, over a month now, and a lot of work has gone into it behind the scenes, and we're really happy to just have everybody here and finally get this event going. We have a lot of, really important people here with us today, and just grateful to have them be part of the panel and excited to hear about the knowledge that they have to share with us. And we're looking forward to your questions and everything. So can't wait to get started. And yeah, welcome. Assalamu alaikum. Yeah, so I can get started. So my name's Abdurrahman Saidi. I'm the founder of Muslim Premeds, and I'm a rising sophomore at Emory University, and I'm a pre-med student. So Muslim Premeds is a new organization that I decided to pursue in making this summer. It began in May. And the purpose of it was to, build a community as well as a hub of resources for Muslim students that are in the pre-medical field and be able to provide sort of that extra boost into getting to a field that is very, very difficult and prestigious, right? And of course, like at the moment, there's so many people I've talked to, whether they were applying to medical school or have already gone in, just talking about how difficult it is, and as well, like the extra layer of difficulty that's added when you are a Muslim in this country. And I wanted to do something to sort of fight back because there's so many times I'd hear from people that, they tried to hide their identity on their applications, or if they were involved with, like, let's say their Muslim Student Association, they wouldn't put it on their application because they thought it would hurt their chances at getting into med school. And so I wanted to sort of take that power back by making Muslim pre-meds and, give the community and give students something they'd be proud of sharing and putting on their application, as well as making a community where people can ask each other questions in a more comfortable space, and as well as give resources to those that need it, because it's all about finding connections and making sure you're doing the right things to get into medical school. And, just to sort of make it centered around the Ummah is something I thought would be great because, the Ummah is full of people that want to help and give. And, we don't just serve pre-med students, we help pre-dental, pre-PA, anything pre-health related. So, and we have a wide variety of members from high school students all the way to people in med school. And, I'm really grateful with how far we've come. And, there's a lot that's going to happen in the future, inshallah, and really grateful to be able to collaborate with AMP today. They're a great organization, and really just looking forward to the future of Muslim pre-meds and continuing our work with AMP as well. Thank you.
Assalamu alaikum, everyone. I guess I go first. Um, I'm Asra Ali. I'm one of the panelists in the clinical exposure of today's webinar. Um, and I actually had a photo up. I'm not sure if that's the next slide. Um, in any case, when it comes up, you'll see. Yeah, here we go. So these are two recent photos. One is me with colleagues of mine, but it was in May at our most recent graduation of the 2025 graduating dental students from Midwestern University. So that is just the culmination of what all of you who are pre-med or in med school or dental school or pharmacy school, that is the culmination of what you've worked so hard for. And the end is achieved, inshallah, once you set your mind to it, once you set your goals and keep reaching each stepping stone, milestone, and getting from point A to finally point Z. It's a lot of steps, but you will get there. And then this other picture is in June of this year. So I go from May, which is probably my easiest part of the year when the clinical dental students are kind of in a routine and they've been there 2 years, the graduating ones, that is, and they know what they're doing. And so our job is much easier. We go from that to June when the incoming third year class comes in and the fourth year class comes in, and they're with patients for the first time. And so we watch everything like a hawk. And especially when it comes to anesthesia, you can imagine the first time working on a live patient is very nerve-wracking, but you get through it. I just wanted to share that because that is another stepping stone before you get to graduation. And I work with the third and fourth year students. So you see us here in this picture, the students in blue are third year students. They're fresh to the clinic floor with new patients, live patients instead of just mannequin heads. And the fourth year students are their partners in black scrubs. And they are continuing on with their education. So you can go to the next slide. There's three areas I wanted to focus on with you guys today. One is sharing your story. That's something that your story of self, basically. So many of us have just gone from um, steps to steps to steps, you know, whether it's graduating high school, being in the top of your class, then trying to get into a good college, then trying to get into a good professional school. We're so focused on these steps, and life nowadays is so busy. We don't take the time to sit down and really reflect on who we are, what we want, where we want to be. Um, and really, that's something only you can answer so that you've all probably heard of that 5 minute elevator pitch that we should all have. It's a real thing. You should have that. You should take the time to sit down and ponder on these questions about what motivates you, what you're passionate about, and why you're doing what you want to be doing. And for each of us, that's going to be our own personal story. And that's how you connect to people. And that's how you relate to what patients, colleagues, um, friends, you name it. Even the interviewer you'll be around at any stage of life for professional school or a job or whatnot. So create your own narrative and tell it genuinely, which takes me to um, the second area um, of focus I'd like to have with you guys is creating your niche. So, what do I mean by that? Say you're in med school or you get in and everything, and generally everyone will have the same level of education. But what is it that really interests you? So you take that from your story of self. What is it that you really seem to enjoy through your education? Is it, for med students in particular, it's pretty easy. If it's something like cardiology, you're going to specialize in that. If it's something with eyes, you're going to specialize in, ophthalmology or whatnot. But within that, say you pick ophthalmology, within that, you can find your niche. Glaucoma specialist or um, focusing in pediatrics within ophthalmology. I'll give you my own example. Now that I've gone into clinical and academics and not as much in private practice, um, I've developed a niche in dental ethics. So a lot of times I'll be the one lecturing on dental ethics, not just within my dental school, but also as part of the American Dental Educators Association. I'm on different committees for that. So once you find your niche, you're going to be the content expert on that, and that sets you apart from others within your field. Similarly, maybe it's something like computers and AI that interests you. Now AI is the hot subject, right? But is it something you really like? You can't force it. You really have to know what you like. If it is, it's a great field to kind of focus in on right now and create that niche for yourself. Um, and then the third area I just wanted to focus on is what interviewers are picking up on. Step one of the interviewing process, first of all, is an awesome cover letter, CV, or resume. I don't want to go into details of that in this short webinar. There's a lot of resources online, a lot of resources through your universities that you can focus in on. But a cover letter, that's your ticket in for an interview. And it's got to be short, concise, and really capture the essence of who you are. And then a resume should not be more than a page. A CV, on the other hand, is everything you've ever worked on, and it can be pages and pages. See what, is asked of you. Is it a resume or is it a CV? A resume is short, succinct, to the point, but you've got to communicate who you are in that, because a person reviewing that, they may spend 30 seconds to a minute and that's it, and move on. Um, so in any case, to summarize, that's your ticket in for an interview. So make it count. Uh, use the services online and through your university that are at your disposal to create really good ones. Um, and then what are interviewers looking at and picking up on? Genuineness first and foremost. So going back to story of self and knowing who you are, communicate that through the interview and practice an interview. Do a mock interview. Ask a friend to go through an interview process with you. Most of those starting questions are the same, just asked in different ways. Tell us about yourself. Why do you want to go into this profession? Why do you want to work with us? And so on and so forth. So have your answers ready, but have them be genuine to who you are. Don't, like Abdul was saying, don't not include something about yourself if you're passionate about it. And similarly, don't include something about yourself just to get in and think that that's what the interviewer wants to hear from you, because they can tell if you're genuine or not, through your body language, through your confidence. They're looking at all of those subtle communications that are not necessarily just in words. So be aware of that. They're looking for preparedness. For example, if you're applying for a job at a particular um, uh, practice, you need to have studied that practice too. Know facts and figures about that practice. Ask good questions as well out of that interviewer. Don't just say, when they say, "Do you have any questions for us?" Have at least one or two questions ready. Um, and I think I'll stop there. I tried to be succinct, but I think I went a little over, and I'll hand it off to the next panelist.
Thank you, Asra. My name is Aisha Siddiqui. I am a pediatric anesthesiologist at Advocate Children's Hospital in Park Ridge, Illinois. Just to give you a little history on where I've been and what I've done, will kind of give you a synopsis of what one of the pathways looks like to medicine. Went to medical school at Michigan State University 4 years. Then did internship, then residency for 3 years at Northwestern, and fellowship for a year, and have been practicing almost 20 years here in the Chicagoland area. Next slide. I wanted to focus on, you know, every step, like Dr. Ali said, every step is difficult. And every step will essentially weed out people that aren't able to hang per se. When you're applying for medical school, you want them to know what sets you apart. They can read your MCAT scores, they can see what organizations you're on, but like Asra says, you have to figure out what your story is and how you set yourself apart from the person that's interviewing after you, or whose resume is going to follow after you. Some examples, and examples that I'm going to give are things that I've seen after being on the interview board at Northwestern, what I thought were important things that stood out, that showed me that certain medical students are stand out more than others. What you're doing during your summer is off. Granted, you don't have much of a summer after your second year, But what are you doing in that time off? Are you just enjoying yourself? Are you traveling? That can be, still something to bring up. You could still learn on your travels. But what are you doing in that time? A lot of the people that really stood out were ones that took jobs in hospitals. Big things that I've seen people do are, back in the day they were called orderlies, but you're kind of doing the brunt work of the behind the scenes. In order to understand how medicine works, you have to understand the whole picture and the whole body. And the physician in and of itself, treating the patient isn't just the practice of medicine, it's everything. So I think that a lot of people that take these orderly jobs that are working either on their off year, or I think they call it gap year now, I think that really stands out. Research is really, really big, and that can either be clinical research or bench research. You can find at any institution, any medical school out there, there's summer programs that help you get into those research programs, get into either clinical research or bench research, because in the big institutions, they're always doing that. And the more competitive residency programs, such as derm, that's what they're looking at. When you're an undergrad, health fraternities really help. Sometimes getting connections and networking with either programs, physicians, subspecialties is important to have, because that kind of gives you the foot in the door. And lastly, I think that one thing that's important to be in the healthcare field is being a leader. And that can be a leader of a youth group. It can be a leader of an organization. It can be a leader of a sports team. So anything that truly has you stand out as a leader is something that the interviewers and medical schools are looking for. I'm in the Chicagoland area. I have interviewed on the interview board at Northwestern. If anyone's interested or needs advice, etc., I'm happy to help. And I will pass the baton on to the next speaker. Oh, sorry. Last thing over there. One thing that I did notice on, sorry, I apologize, is what makes you happy? And adding to what Dr. Ali said, when you're talking to interviewers, be genuine, like she said, and don't make anything up. Speak on what makes you happy, because when you can speak from the heart and answer from the heart, they'll know and they'll be able to appreciate that. So sorry for what, I'll pass it on to you.
All right, no worries. Thank you. Can you all hear me?
Now we can, yeah.
That's correct.
All right, thank you. My name is Fawad Khan. I'm an academic neurologist based in New Orleans. I work for Ochsner Health and faculty at Tulane and University of Queensland. So thank you for this opportunity. I thought I'd touch on certain topics of interest, which will help in professional development. Actually, if you don't mind navigating to the next slide, please. All right, so I'd like to focus on the CV. I think this is a very important segue into how you sort of describe yourself, and a lot of folks will look at this in detail. And first of all, you need to make sure that it's well organized, it's structured, there's a flow, there's no spelling errors, no grammatical errors, those things. Usually it's a good summary which describes your accomplishments, who you are, and where you are in your career pathway. There are other versions like a resume that Ali mentioned. It should be a one-pager, really succinct, simple, and should give you a synopsis of who you are and what you're interested in. Sometimes you see different versions like an executive summary, which will highlight your accomplishments, your ranking, and kind of where you want to go as the next step. What's important in those, you may want to include a paragraph which talks about some of your key accomplishments, but also some of the challenges that you've had and what you're interested in. If you're going down the pathway of research and grant applications, and NIH BioSketch is very important, and knowing how to write this. A lot of institutions have guidance on this, so make sure you go through this. There's certain caveats to this. It's maximum 5 pages, and certain areas where you really need to focus on trying to get the message across to reviewers. You want to include your academic rank. CV is a good place to showcase, your accomplishments, even if they're not specifically in your particular area, right? Even whether they're in the realm of professional in healthcare or even outside healthcare. I've got awards that I've received not related to healthcare that I've included in my CV, and I think that's really helpful because it shows sort of overall well-rounded person. So this is something that you want to keep in mind when you're putting this together. Sometimes people add a picture, sometimes they don't. It's not required. Sometimes you can have references. If you don't have references also, it's not necessarily required. If your CV is long, if it starts to cross like 12, 14 pages, you may abbreviate areas and say, please contact me for further details. Next slide, please. Thank you. So some of the qualities, and these are really important for professional growth and development, and advancement in your career. One thing that my mentors have always told me is always have a passion and have a plan. And even early on when I was applying for residency, when I approached a program director and talked about their program, they said, well, can you give me an example of something you're passionate about and how you pursued it? Because that really tells you how you can focus on something, build something, and continue to develop and grow in a particular area. It can be anything. It could be a hobby. I've interviewed numerous students and candidates, sit on several committees, and I'll ask them about their hobbies because I want to know what they can pursue, where they can add value to society, for instance, through their hobby. So when you walk into interviews, always remember to talk about your hobbies and think of something that's really tangible and meaningful. Sure, I'll get to Brandon. Give me a second. And then having a structured approach whenever you come across barriers is really important. And talking about that in whatever you have a passion for is really key. Next, leadership, as Dr. Siddiqui mentioned, it's really, really important to have leadership, right? There are a lot of fallacies in this. I've had people tell me that I'm not a leader type. I like to kind of follow. I feel uncomfortable when people have to look up to me. And I always tell them it's not about glamour. It's not about the spotlight. It's not about a popularity contest. Leadership in healthcare is about how you influence your peers, how you influence others in the field, and how they respect you. And so that's how you grow in leadership. When it comes to managing people, that's an art and skill itself. And if you don't have that, that's fine. But you can still be a leader. You can be a leader in your field. You can be a leader in your institution. And I think we have to really understand this, even through the lens of our faith, because in the fabric of our Iman, leadership is there. You lead your family. You lead your community. You lead to society. And if we don't, then others will. And so leadership is something that we need to pursue. And it's great to see, I go to so many conferences or organizations, committees. Whenever I see a Muslim name, it's really great to see that someone has actually taken the time to pursue that, and has reached that point where they now can become, useful and impactful to other individuals. So I think that's an area, and it doesn't have to, you don't have to be a president of an organization, as long as you show that you are part of a mission-driven initiative, and that you can lead it to the next step, and then you have a vision, a plan to take it further. That's really important, and articulating that, especially like in an interview, I think it's going to be really key. Another thing is integrity. There's so many leaders out there who are just self-driven, have their own agenda, want to take credit for everything. That's not what you want. right? When I'm interviewing someone, when I'm reading through the CV, I'm like, that's great, you have other accomplishments, but you don't have integrity. I don't want to work with you. I don't want to allocate responsibilities to you. I don't want you leading a team. So being humble, recognizing your failures, understanding, taking, constructive criticism. A lot of the things that we can sort of essentially adopt from our religion, right? And just look at the books of Sirah, look at the Caliphs and Sahabis in their life. You'll learn so much about just you know being someone who exemplifies good character, and don't compromise. Sometimes you get opportunities to grow in your career, and there's a point where you may jeopardize your integrity, and you never do that because that will always bite you at the end. And the next is professional or personal branding. You really have to be intentional about this, and have a strategic outlook in how you define yourself and how you express your value, right? The reason this is important is because it helps clarify your own goals, your own values. It removes you from that imposter syndrome that folks have, and it helps people understand the authentic you, right? There are a lot of elements in this. Like one element Dr. Ali mentioned, like creating your niche is one of them. There was a recent Harvard Business Review article which talked about, just look in the mirror and ask questions, and then write down the answers, and then try to summarize that. And the questions could be, what are my values? What's important to me? How do I define myself? What makes me special? What makes me stand out? These are all things that, sometimes we don't take the time to look at this in a more systematic manner, but that's very important. And keeping those highlights at the top of your mind will really help you advance your career and help people understand who you really are. And sometimes just writing it down, making a narrative of this, LinkedIn profiles, social media profiles will allow you to put like a sentence or two, or even a paragraph, and putting this, and then updating it every month will really help you understand kind of where you are, the value you bring, and then allow people to look at, because when someone has meet you for the first time, reads your CV, they don't know, they're formulating an opinion about you. You want to direct how that opinion needs to be formulated, and that's where this comes in. If you go to the next slide, please. So this is more thematic. When you're going up the ladder and trying to achieve new heights and look for successful new positions, always make sure you understand what that position, that opportunity is, before just jumping to it, because it might look great, but it may not be the right fit for you. And sometimes, I reached out to individuals, and I was interested in a position, and instead of saying, well, here's my CV, here's all the great things that I did, and I want this position, what do I do? It was the first point was, well, is this the right fit for me? Can you tell me? Can you tell me what you're looking for? And what does this entail? And sometimes you'd be surprised to know that it may not be the right fit for you. It actually might, it might hurt you. So being mindful of that, when you're like the dream position or dream job, is to really understand what it is, and talk to people who were in that position, who are part of that. It's going to be really important. The other thing that keep in mind is, as you're growing in success, it's very easy to sort of become, as you call it, the victim of your own success, right? Fall into the trap, the hype, become greedy, going higher, money. All those things can take something really positive, your drive, your motivation, your talent, and turn into something really negative. And then add a layer that we all want to avoid, like as a Muslim, arrogance, right? And that can happen. And I've seen it so many times in so many individuals. So as much as it's important to have your branding in place, and really focus on how you're going to grow in your career, and take advice from individuals, it's really important to also be grounded, because even the most pious, even religious scholars fall into this trap that I'm too good, I don't need to ask for forgiveness, for instance. So really humbling yourself, and it's beautiful that our religion allows us to do that, right? I was just given an award, and I told him that receiving this award is a matter of great pride, and I work with a great team, and I went from here to here at a much higher level, but it's only an hour from now that I'm going to go pray Asr, and I'm going to bow and prostrate and put my head down to the ground, and then go back to being humble again. And that's very important because inshallah God will let you succeed, but you can't forget that you need to go back and reflect and continue to be humble in this pursuit. So I wish everyone the best. If you have any questions, feel free to contact me, and I'll let you continue with the next panelist. Thank you.
Thank you so much, Fawad. We have Shoaib.
So, assalamu alaikum, everybody. Good evening. And we're going to pivot now to the healthcare administration professions. So, thank you to all our clinical folks for their wonderful insights and their contribution for this webinar. So, just a little bit about me. So, I'm the current executive director for American Muslim Health Professionals. My background is in healthcare operations and infrastructure development. I attained a bachelor degree in public health, MPH, at University of Florida. Prior to that, I got my bachelor's degree in biomedical science. My kind of early on career path was in pre-med. And I started the journey out being a clinician and going in that mindset, but I quickly pivoted because I was always a business person. I always loved crunching numbers, working spreadsheets, the opposite of what a clinician would like to see. So I pivoted and got my master's degree in public health and really pursued and had, alhamdulillah, very great opportunities along the way. Prior to joining AMP, I was the vice president and chief operating officer for HCA Healthcare, which is the largest provider in the United States. And then prior to that, I was also within the company, the senior director of clinical affairs at Florida division. Christian, we can move on to the next slide. So just kind of professional insights, those who are trying to go into the healthcare administration route, trying to navigate where their direction is, and given kind of where we are in the circumstances that we are in, and kind of with the development and evolution of the healthcare industry, the things that have really worked successfully, for me at least, have been kind of affiliating. It's a who's who type of networking industry. So I would say the biggest and the most important imperative thing would be affiliations. So early on, getting yourself acclimated, developing that backbone within yourself, and having that confidence, and engaging with folks that may be having different backgrounds with you than you. So for me, I would say the greatest thing had been joining the American College of Healthcare Executives. And MGMA, they're kind of major, large healthcare executive professional backgrounds. There are a lot of educational resources through those affiliations. So you really get to see and attend like conferences, get yourself engaged, including our organization, like American Muslim Health Professionals, where there are opportunities to engage with different stakeholders and different members of the healthcare community. So that brings me to my second point with networking. It's like building meaningful and impactful relationships. So aside from just developing superficial kind of conversations, developing meaningful conversation and really taking that to the next level, follow through is very important. So when you meet folks, it's very important to follow them. It's given the utilities that we have now, such as like LinkedIn and other social media, that kind of gives us a little bit more runway and opportunity to do that. For me back in the day, and now I feel kind of my age is showing now. It's because it'd be following up with an email or following up with a letter in the actual physical mail, or a phone call. So nowadays it's a lot more convenient in really having access to those individuals. So the next point that I have here is advancement opportunities. So one thing that has been, quite a huge facet of mine is, making sure that you're assessing your opportunities. Complacency is one of those things in any career that you choose, in any professional pathway that you choose. You have to make an assessment. You have to sit down and really understand, and do an assessment of where you see yourself, not only in the given moment, but kind of in the scope of 3-year, 5-year, 10-year. And, that's kind of cliche stuff, but honestly, it really has helped me and benefited me in the sense that you want to make an assessment and say, okay, am I really happy in where I am now? Where do I see myself? Am I shortcoming myself in terms of the skill set I'm applying to? I have my quote here where I say titles don't define success. It really is the opportunity you're able to impact and putting forefront what that impact looks like, whether it is in a community, in the nonprofit world, or if it is with your patient and the patient outcomes that you have and guiding healthcare infrastructure. It's really important to identify what your impact is and then kind of working up to that. So then I have the can-do attitude that goes into the can-do attitude, really building up, going back to confidence and self-esteem. There's a lot of red tape and a lot of different kind of barriers in the healthcare admin world, especially when you go up the C-suite kind of political tier. But to kind of overcome that, it's very imperative to understand your confidence and your ability to speak, and you have a voice, and that you can represent that in the best way possible. Then I have the last point as data is a driver for performance, but people and patients. So understanding the mission in whatever organization you are in, whatever kind of company, whether it is in the private side or on the public side, understanding what that mission and that value is. And I know it's very cliche. Those are things that you hear in like the initial onboarding, and then it's in 1 year and out the other. But really, that truly is the driving force behind what your contribution is to that organization. So embracing that, is key principle. That's kind of what I put down here. If there's any follow-up questions that you guys have, feel free to drop them in the chat. You can follow, me. I'm really bad at social media personally myself, but I can drop my email and you guys can reach me there. Thank you so much.
Assalamu alaikum, everyone. I'd like to start by saying, by thanking Am for inviting me to this conversation, and Abdullah for initiating this idea. I see that there's a lot of people over here. From the questions I see, there's a mix of people who want to go the clinical path and public health focused people. I am also going to speak on the health administration side of things. My name's Faraz Siddiqui. I'm a healthcare lawyer. I have a background in public health. I've worked as an epidemiologist, as a healthcare researcher, both in the United States and overseas, in more of a global health sort of setting. I want to give you a few practical tips on, and this may be more suited for people who are in public health than people who have a path built out for them, who are going to a professional school like medicine or nursing or dentistry. I'll break down the advice that I want to share in a few points. I prefer not to use slides. So if you are following and if you would like to take notes, please do so. So I often remember something that the dean at my public health school said. He said, we want to move from having professionals in public health to having public health professionals. Over the last 10 or 20 years, there's been a move towards getting public health people become more of a professional setting. I don't think it'll ever become a very a very regimented profession, just because there's so much variety of ways in how you can approach public health, many different jobs, that you can do, many different careers that you can do. So, but we are always, but as people who have a public health background, we are looking to add some professional to do some work in a professional capacity. I myself ended up going to law school and then put my two backgrounds together to work in healthcare law, drug development, food and drug law, and jobs of that kind. But before law school, I worked as an epidemiologist. Oh yeah, I just said that. Okay, maybe I should have had slides, huh? Okay. So, the first thing for public health, for people in public health, it is very important for you to specify what it is that you want to do. The more that you can, even if you take away specific jobs or path that you don't want to do, that is you're moving towards specifying what you want to do. That is good. It's such a vast and broad field. I know, especially people who are applying for jobs, they'll take whatever they can get in certain economies or certain markets. However, at least try and develop some sort of lodestar, try and develop some sort of aim in the area that you're going. Try and develop that both by doing your research and thinking about what you are interested in. Try and specify what you want to do in at least 3 different areas. First of all, try and understand the kind of the kind of role you want to play in the future. Maybe think about it in your first job and that you're applying to right now, or the next job you're applying to, and eventually in 5 or 10 or 20 years, the kind of role you want. Do you want to be someone who puts together public health programs for a city? Do you want to be someone who works at a federal level to do research in public health? Do you want to be an epidemiologist? Do you use like hard data or biostatistician? Do you have good IT and tech background, and do you want to do health IT? Do you want to do do you want to get some sort of administrative health administrative kinds of jobs like a C-suite manager or that kind of thing? Think about what role you want to take up in your job, in your career, I should say. So specify that with as much specificity as you can. If you go into interviews and say, I'm just looking for anything, I'm just interested in all of it, that sounds not only immature, but also repetitive and cliche. No one wants to, give a job, or no one wants to work with someone who's just interested in doing everything. No, define your interests in the specific sort of role that you will bring to an employer or an organization. The second place where you should specify what you want to do is the kind of expertise that you will bring to that job. So this is more from the substantive point of view. Are you interested in environmental health? Are you interested in maternal and child care health? Are you interested in communicable diseases? Do you have an MD and you want to work as a clinician and just do like population health work? So bring the sort of expertise, the substantive area in focus. And if you are, I saw someone said that they are studying, they're doing an MPH. Go look at the different course selections that you have and try and figure out what areas of public health are there. For example, do you know about occupational health? Occupational health itself has become a very solid area of public health, and it has its own journals and literature and all of that, and it's you can specify in that area. And finally, think about the geography that you are thinking about. I used to say this when I talk to people who are interested in global health, because different countries, different settings, different language skills can bring you in different places. But even if you are focused in the United States, think about like which city you want to be in. Are you going to go to the West Coast where you have a more entrepreneurship opportunities, or Boston opportunities, those kinds of opportunities, or will you be in, I don't know, the Twin Cities, and you have a lot of like small and large hospitals. Think about if you want to work in a rural, suburban setting or a large city setting, you want to work for a community hospital or you want to work for a large academic center. So those are the three areas that you can specify that I urge you to spend time specifying before you go out looking for work. And then, and I'll try and wrap it up quickly. Uh, Try and tailor your resume to specific kinds of jobs that you're looking at. Think of at least 2 or 3 different jobs. How do you tailor it? Look at 5, 10, 15 different um, uh, postings in that area. Look at what people are looking for. People take a lot of time writing these job descriptions, but it's only really the top 1, 2, or 3 bullet points that you like sit and think about what they mean when someone says you should help outreach for certain something. Like think about what skills and experience that requires, and then tailor your resume to that. Unfortunately, there is also something said about just doing a lot of quantity of resumes instead of changing every single one, but try and find some happy medium between them. And finally, let's yeah, there. I think in question and answers, maybe people can ask questions about how to use LinkedIn. But that's about it. I'm happy to talk to you one-on-one. My LinkedIn is over here. Please send me a message and we can connect. Thank you. Assalamu alaikum.
Assalamu alaikum, everyone. My name is Syed Heather Hussein. I go by either Syed or Heather, and I'm currently a PhD student in healthcare management and health policy at the University of Texas Health Science Center at Houston, particularly the School of Public Health. But hopefully, I won't be a student for too long since I'm planning on defending my dissertation in the next 2 upcoming weeks, which is focused on access to care and mental health, as well as improving the quality of care. What I thought would be really helpful for this session was to just briefly walk through my educational background and just explain how I got here, because I ended up doing both pre-med and then also ended up going through the administrative route. And I do want us to have some time for questions at the end, so I'll try to be brief about it. Just on a personal background, my family immigrated to the US from Saudi Arabia, and I knew I wanted to do medicine from a very young age. So going into undergrad, like majority of pre-health people, I just decided to major in biology because that knocks off a lot of your prerequisites going into any health industry. And at the time, I also decided to minor in public health. And as I was taking a lot of the public health classes, I really became interested in things such as social determinants of health, which are the non-clinical factors that shape health outcomes. And as I started getting more into the public health classes and learning about policies and administrative side of things that shape healthcare, I wanted to learn more about the US healthcare system, because oftentimes we hear statistics such as the US spending the most on healthcare, yet still not having the best outcomes. And considering we have some of the best physicians, I really wanted to explore this inefficiency in the healthcare system and solve it. So come 2020, which was, I believe, my junior or senior year, instead of applying to medical schools, I decided to enroll in MPH at UT Health, really in the healthcare management policy to learn more about the health system and how to improve the healthcare system going forward, and becoming a doctor later on. And at the end of my MPH program, I learned about the healthcare system, but you really don't learn these skills and ways to systematically think through those problems and really innovate, which ultimately led me into enrolling in the PhD program in healthcare management, health policy, which is where I'm at. And ultimately, my professional goal is really to merge research, management, policy, and medicine all together. I have no idea what it will look like in the future. But if you were to ask me 5 years ago if I do a PhD in this, I would have said absolutely not. I couldn't imagine myself doing it. So it's something which I'll have to figure out, and it'd be interesting to see what merging all of those look like. But ultimately, I did want to share that my career path wasn't linear. I think a lot of people going into just health decide that right after undergrad they want to do something, and along the way you learn about different opportunities and different things that interest you, and it's okay to pursue those paths and okay to explore those opportunities. And finally, I want to end off with some advice for a future health professional, or just for myself. If I were to go back and give advice to myself, the first is to be proactive. I think a lot of the opportunities I've gotten, whether it be in research, shadowing, or volunteering, weren't handed out or given to me. You have to be proactive, reach out to those people. And a lot of the times you will get ghosted, and the answer might be no. But it's fine because at the end of the day, you only need either one or two opportunities and you can build up from there. The second is don't be afraid to explore interdisciplinary paths. And what I mean by this is instead of trying to check off a bucket list of everything that you think makes a perfect pre-med or a perfect pre-dental, do things that you're interested in, because when it comes time to applying for these graduate schools, people aren't going to see whether you checked off everything. They'll see what makes you different, and things that you do outside of your industry are going to stand out more. And then lastly, find mentors who support your academic and personal growth. For me, having mentors who were able to help me, watch for me, was really beneficial, just not in only getting opportunities, but also when it comes time to ask for a lot of recommendations. And that's pretty much it on my section. Thank you.
Thank you so much, Syed. Now we can move on to the Q&A section that we have. So everyone, please feel free to include your questions on the chat, and then we're gonna try to respond a couple of them.
That is correct. We'll be able to send the recording of this meeting, and this meeting will also be uploaded to our YouTube page. So be on the lookout for that.
Okay, I see a question for Syed Hussein. Mari Hakan is asking, how long was your PhD program after your MPH, and did any credits transfer from your MPH?
I really wish they did, but they did not. MPH programs on average are about 2 years. I just really wanted to get through school, so I ended up overloading a lot of my classes. So I finished MPH, which was, I believe, 45 credit hours in 1.5 years. And then similarly for PhD program as well, it ranges from 4 to 7 years. But I really wanted to get through the PhD program as well. And then I've had a lot of research experience going into my PhD program. So inshallah, this will be my end of third year, and I will be graduating, inshallah.
Thank you so much for responding. We got another question from Afshan. How can doing an MPH before residency will help you? And also, does it goes in favor or against the residency route?
I can speak to that a little bit, but perhaps Dr. Siddiqui may have some thoughts on it. The reason I think I can speak to it is because I've had many people in my MPH class who were doing something called a preventative medicine residency, or including my wife, actually. where they got to do an MPH and then do some rotations with various like public health organizations, including the WHO and others. And then they could, develop other skills or do more training. I think it really depends on what kind of work, what kind of residency you're looking for. If you do something like primary care or family health, I think an MPH can add a population health lens to that work. If you are going to do some a specialization in a certain area like cardiology or neurology, then if you could do an MPH going into that. I mean, what do I know about these? From what I understand, you have to do your basic training and then these other trainings. But we had some friends who did this, and they were taking the academic route. They wanted the public health background to get the biostatistics and epidemiology background so that they can then use it to publish, to do research. They needed that sort of background in for example, outcomes research and things like that. I'm a very big fan of taking a break in your education and not leaving it to the end. I think if you do a residency, you'll be think about how many years is it, where in your life you are at, will you actually go back and do a public health degree, or does it make sense to take that little break over there? There's a lot of like personal factors that apply over there also. I hope that's at least a little bit helpful, but other people may have more to say on that.
I'll add that you're always learning. I've been in practice 20 years and I'm at this point going to go back to get my MBA. So I think it doesn't matter where you sandwich it in, and if I'm misunderstanding the question, please correct me. But regarding getting experience, you can contact hospitals, and they'll forward you, in their job description areas on positions that don't require actual certifications. A lot of the places will require a certified nurse assistant. But nowadays there's different degrees, because there's different degrees of those jobs available now, because they know that not everyone's going to be able to get a CNA license, even though it's a very short time commitment to get that done. But there are positions that you don't need to actually have a certification.
And for those applying for, some of these professional schools, be it med school, dental school, pharmacy, whatnot, PA school, you can always shadow different people in that chosen career path. People love to mentor others. Most people in healthcare will be happy to do that. And it really, really is great to see what real work is like before you apply and put all these years into pursuing a career that you may not really like. So it really behooves you to ensure that it's something you do want to do. And the only way to see that is by shadowing different practices, different people, not just one or two, but I would say 4 or 5.
Thank you so much, everyone, for sharing. And the last question that we have on the chat is from Rowan. He wanted to ask how undergraduate students can get relevant healthcare experience without getting certificates like being a registered nursing assistant or a medical assistant.
I can answer that. I think I tried to answer it before, but there are positions available without getting those. You just have to look on the different hospital websites. If you contact me, I put my email in there. I can kind of guide you through what our hospital job descriptions are and how to look for them.
Okay, so we have now finalized the Q&A section. Thank you so much everyone for attending. And here you are able to find our website and all of our social media channels. And yeah, thank you so much for your time. Thank you so much also all of our panelists that we have today. And yeah, take care.
Thank you so much.
Thank you. Assalamu alaikum.
Good luck to everyone. Assalamu alaikum.